I was 15 years old when I started noticing that I had lymphedema in my toes. I woke up one morning and it was in my foot. I didn't think anything of it though because I was playing basketball and very active. I thought maybe I just did something on the court. The next day I woke up and it was gone, and that continued to happen over the course of 6 months until the swelling was at my knee, and then it stayed. At that point, I decided it was time to go see a doctor and figure out what was going on. I went to my family doctor and she told me it was nothing, to take aspirin and it would go away in a week. I did that, it did not go away. The swelling continued to progress. I saw a podiatrist and he said that my right leg was 2 inches shorter than my left, and so the swelling was caused by having to compensate when I was walking, which didn't make sense to me at the time, but it was an answer. So he ordered shoe orthotics so to raise my leg, and before they even came, he said, if it gets up to your thigh, this is not it. Then about a month later, it was in my thigh and it was continuing to progress, and I went and saw a vascular surgeon, and he was actually the one that diagnosed me. So it was about 6 months from the time I started seeing a doctor to the time I actually found out what was going on. So once I received the diagnosis, I was transferred or referred to a orthopedic and sports rehab medicine doctor who got me set up with a occupational therapist for manual lymphatic drainage. In the beginning, I saw the therapist 5 days a week for 2 months, every day for MLD. We used a pneumatic compression pump, and then she would wrap me in foam and bandages and send me home, go back the next day and do the exact same thing. Then I asked to be transferred to the Mayo Clinic after 6 months of this treatment that wasn't working and wanted a second opinion. They sent me home and said, manual lymphatic drainage is the only thing that we can do to help you. At that point, I was 2 years into my lymphedema, and I got my first compression stocking and was also wrapping on the side along with going through manual lymphatic drainage. I have tried everything possible to manage my lymphedema on my own, to changing my diet, to exercise, to going to a chiropractor, getting acupuncture, trying herbal remedies. I would say about 5 years into having lymphedema was the point where I said, no, I am done living a life that is revolving around foam, ACE bandages, pneumatic pumps, going to the doctor every single day. It was just, there had to be something more, there had to be another answer to this. So I started researching every day for something new, and I found that there was surgery options, although controversial and still investigational to some. There's surgical procedures that could manage and eliminate lymphedema. I flew out to have a consultation with Dr. Granzow in California. The day before my procedure, I got a call from the hospital saying, your insurance company is not going to pay for this. It's not medically necessary. And at that point, I thought that was it. I thought that it was game over. I have to live with this for the rest of my life. And I was very, very upset about it, especially thinking that tomorrow my life is supposed to change and that's not going to happen. I stopped fighting. I went back to the normal managing treatments. And then I decided to fight again last year. I'm not one that's willing to accept that this is a lifelong thing for me. So I started the fight against the insurance company again back in December. I wrote them a 5-page letter as to why this is medically necessary, both mentally and physically. They agreed with me that this surgery will change my life for the better in a multitude of ways. So in 2 weeks, I will finally be having surgery. I think the most challenging part of having lymphedema is the side effects that come with lymphedema, and that's not just the pain or the large limb and the swelling and the discomfort, but the the mental aspect, the mental side has been the hardest part. Is I woke up one day and my whole life was different. I wasn't the girl I was the day before, and there was no reason to explain why my leg is now double the size of the other one. And at 15 years old, to try and rationalize that, to try and go about my normal life, to try and fit in still, was the hardest part, and it was impossible. And I was diagnosed with depression and just very, very beside myself. I didn't feel like I was me anymore. I shut everyone out. I basically locked myself in a room because I couldn't understand why this happened to me. And it's a side effect of lymphedema that nobody tells you about, and they don't talk about it with you. And it just got to a point where I said, enough, I want to live my life, I want to be happy, I want to do whatever I want to do, and I want to stop caring about what people think about me. And so a switch flipped, and I just changed. I was honest. I told everyone, this is who I am, and there's nothing I can do to change it. And it was the best decision of my life. It was like this weight holding me down that I put on myself, and as soon as I released it, I was a completely different person. For many years, going in to see a new doctor, I would have to explain my condition to my doctor for them to understand what I need. I'd also have to tell them, I need you to refer me to an occupational therapist who is licensed in treating lymphedema patients, which is speaking a foreign language to most providers who are not very familiar with this condition. And it's very concerning on my part as the patient to explain what my medical care should be. So it was really hard for a long time trying to get people up to speed on what I was going through, and having to realize that I'm the one who has to be my own advocate in my care because other people don't know how to treat me. So now I'm at a point where I can go see my doctor and I don't have to explain things anymore. But for about 10 years, it was me owning my own care. It's been a very, very difficult journey as the patient trying to figure out how to help myself. I wish I knew in that first year that compression would give me so much relief, it would minimize the swelling, and it would just make me feel better. I can't go a day without my compression stocking on. I absolutely cannot. It's immediate relief. And in my journey over the last couple of years, I've spoken with a lot of patients who are living with lymphedema that are not wearing compression and they don't know that they need to be. So my number one thing is, get a compression stocking immediately. It will save your life. It will make you feel so much better. There's one thing that I wish the general public knew about lymphedema. It would be the fact that they just knew lymphedema, what it was, that it existed, that they know lymphedema just in general. And there's a lot that goes into having lymphedema, and it's usually a side effect of having another medical condition, and there are so many side effects that come out of having lymphedema, such as depression and the pain and the exhaustion that's associated with it. So understanding that it's just like any other medical condition and to treat it that way. So when you see someone on the street that has one limb larger than the other, to not point or laugh at it, to understand that it's a product of something else and there's so much else behind it. So having more providers in the field, having more therapists who are trained to work on lymphedema patients would be ideal. It would greatly benefit the care for people living with lymphedema. For me, I was lucky enough that it was only a 30-minute drive, but I know that for a lot of patients, it's 2 hours a day just to go to get the care that you need.